Thank you all for joining us today. I'm Jen Harris, Montgomery County. And of course, we have Dr. Bissell here to talk about what's going on currently in the New River Valley. If you have any questions, as always, feel free to ask those using the chat or the Q&A. Thank you.
Hi, Jen. Thank you so much. Everyone, thank you very much for joining us. Kind of switching to a Tuesday after the Monday holiday. Just want to say that as we expected and as we're seeing across the state, across the country, the cases are dropping pretty quickly. Hospitalizations are also dropping as well. And then even our deaths, although they are still above 2,000 a day nationwide, deaths are starting to see that drop as well. So everything's heading in the right direction. Again, really trying to focus people on individual risk assessments, individual risk tolerance, trying to shift that personal protection from masking. I know the federal government's been getting the KN95s, N95s out to CVS's and other stores, pharmacies across the country. I was in CVS and saw the bags with them packaged. And a lot of our community partners have also received them and are trying to distribute them out as well. So trending in the right direction. That's not to say that we are not acknowledging that COVID is still here. COVID's not going to go away. COVID is still very serious. But we do know again that, for those who are vaccinated and those who are boosted, that even though they get COVID, they can still get COVID, that the risk of hospitalization, severe disease, and death is very, very low. And that protection is seeming to be very durable right now. So I think as we, hopefully move out of this wave, the Omicron, the B2 variant, for those who've already been infected with the first variant, it's unlikely to present a significant problem. And we know a lot more people than we've documented have been infected with Omicron. So if anything, it may lead to the tail of our curve extending out a little bit rather than dropping as it has. But we certainly don't expect that it's going to cause a significant change. But again, we do expect that there will be other variants in time, probably regional, seasonal spread, just like we see with other respiratory illnesses. And so we'll kind of have to be prepared as we do with those other ones. So I'll go ahead and take questions. And
great. Yeah, our first question is coming in from Jean. Again, if you have questions, feel free to ask them using the chat or the Q&A. He's saying, I saw where the U.S. infection rate has gone down 64% in the last 2 weeks. Are you seeing anything like that dip in the New River district?
Yeah, so last week, our cases were down about 35 to 40% over the week prior. The week prior, they had been down about 25% from the week before that. And this week, just this week, between this week and last week, we're down about 50% in most of our areas. So yes, I think that trend, Omicron is so transmissible that the case rates went up pretty significantly. And then usually the curve, they go down pretty significantly as well. So we are seeing that as well.
Okay, Danner is asking, do you think masks should be optional in schools?
I do. I think, as I said, we need to really shift to the masks protecting the individual. And, the masking issue, unfortunately, became so politically divisive. And, we had data from pre-pandemic that really didn't show significant efficacy of community masking in stopping the spread of flu. When you're in the midst of a pandemic and it's an emergency, it's a crisis, then, you want to try and implement measures that you feel like could benefit. But part of doing that, you need to kind of have an end game. You need to look at how effective those measures are. And I think what we've seen, although we don't have a lot of real good randomized studies, which would be the ideal thing, but we have seen, looking at data from places where masks were mandated in schools, masks were not mandated in schools, is that with the earlier variants, maybe there was some efficacy, and it makes sense. They do have a little bit of a barrier there, but with Omicron, not at all. Really, the curves, they really are pretty much the same. So somehow or other we got around to the community masking, and we got away from the individual protection that masking can confer. And I think we all acknowledge that the cloth masks, the cloth face coverings really are not super effective in protecting the wearer. The medical surgical masks, especially if you do the little knot and tuck method, that can provide a little bit better of a fit, because the mask is only as good as the compliance and how good of a fit. They can provide some protection, and then certainly the N95 is a little bit more. That the gold standard with viral particle aerosol transmission has been the fitted N95, but that's not something that's realistic for the community or for individuals to wear for long periods of time. So we really should be looking at that individual protection, and the type of mask and the compliance with the mask. Obviously, fit is much better. And so I do think we're at that point right now. And I think, I cover 21 districts. All but one of my districts had gone to masking optionals in the schools on January 24th, and their curves did not change at all. They still kind of peaked as we expected Omicron would, and then they have started coming down. I will say that most of the school districts, they still have a large number of students who are continuing to wear masks. And I think the biggest thing is that it's a personal choice, and people should not be shamed or blamed either way. Those who want to wear a mask for that individual protection, I think, that's a nice tool for them to have. And, again, it's part of that risk assessment, that risk tolerance. Those who don't want a mask, the same thing. If the masking is optional, they don't have to. But I don't think it should go either way, where there should be bullying or blaming. We need to move to that step of individual choice and protection.
Okay, Danner, while you were answering that, she's hoping that you'll be able to speak more to the data that you were referring to about wearing masks in general. Is that something that you could speak to?
So, you can, there are lots of places that have taken data off of the Johns Hopkins website, off of the CDC website, and they've created curves based on the cases. And they've done those comparing states that have mask mandates and states that don't have mask mandates. And then they've done those in states that have school mask mandates and schools that don't have mask mandates. And the curves are, very much the trends are the same. So the curves look the same shape, and then they're almost exact overlays. And again, when we talk about masking and when we talk about mask mandates, you still have to look at the compliance and are they wearing it well, what kind of mask it is, what kind of fit it is. The CDC recently put out data showing that cloth masks, and the Bangladesh study showed that cloth masks really don't show any protection whatsoever. And again, the surgical masks can provide a little bit of a mild to moderate protection. And again, N95s, we know from the fitted N95s provide more protection. The Michigan Department of Health put out reports that they had done in conjunction with University of Michigan. And in October, they showed graphs of schools with mask mandates versus schools without mask mandates. And it looked like there might be some benefit from the schools having mandates versus those without. But by December, when they showed that same report, that any kind of benefit had really been erased. And of course, that's the Omicron surge. So there was no difference between the schools that had mask mandates in place and those that didn't have mask mandates in place. And, this is something we've known throughout the entire pandemic for the most part, that the cases in our school children, they reflect our community spread. We did not at all see that in places with mask mandates, the community or the cases were less than what we were seeing in the community versus cases in schools that didn't have mask mandates. So, and again, I think that's reflective of the fact that if you have people wearing cloth masks, they really aren't effective for aerosol spread. And it's reflective of compliance and just, and the fact that we know most transmission occurs at home and is occurring in other social situations. So I think all of that coming together, kind of helps support that we have to move to the masking for individual protection. And certainly it has to be worn well. Compliance has to be good. It has to be well fitting. And then you have to use the material based on your risk assessment, your risk tolerance. Cloth masks really don't provide much. The surgical masks are a little bit of a step up. The N95 material is more of a step up. And as I said, the fitted N95s, those require, healthcare providers have worn those with airborne precautions. So people who have TB or concerning for TB, but those require kind of a medical questionnaire to be done first, because they definitely do increase the work of breathing when you wear them for prolonged times. So the fitted N95s are even a step above the N95s you buy over the counter, and you try to make them fit your face as best they can with that metal piece over the nose and that cup-like structure.
Thank you for that. We've got a couple questions coming in from Rachel next. The Roanoke Allegheny County Health District has seen a spike in hepatitis A cases recently, specifically from those struggling with substance abuse and injectables. Is the NRV seeing the same type of trend?
So we are not seeing the same spike that Roanoke has seen, but we have seen people, our substance using population doesn't stay in one locality. So for instance, we have seen some cases that are related to that. I will say that hepatitis A prior to COVID, we were all seeing increased hepatitis A cases in our homeless populations and our substance using populations. And we've done a lot trying to promote vaccination at some of our homeless shelters. And we've done a lot trying to promote vaccination in our substance using communities. So hepatitis A is a very real threat, and unfortunately can cause illness and death, as we saw after the foodborne hepatitis A outbreak recently. And I know this is not related to that, but it still tells us that there are other diseases out there, such as hepatitis A, that we have to really try to pay attention to and get people vaccinated.
Okay, Rachel has another question. We also heard about an unusual stomach bug that was overflowing hospitals in the Roanoke Valley. Is this something that's being seen in the NRV as well?
So we are definitely, our hospitals are not being overwhelmed by it, or our hospitals are definitely seeing gastroenteritis type things, nausea, vomiting, diarrhea. We have gotten anecdotal reports of it. We have not seen any situation where we think there's an outbreak that we need to be following up on right now. But certainly, again, it speaks to there are lots of other viruses, lots of other things out there that can make people ill. And it's those basic public health precautions. Hepatitis A specifically, the vaccine is very, very protective. Other things, washing your hands, especially after using the restroom, especially before handling any food, because that's how a lot of these things are transmitted, with dirty hands, and then people eat. Those things go a long way to protecting against those types of illnesses.
Okay, Nick is asking, could you talk a little more about the Omicron variant? I believe it's called BA2. Has it been identified locally? And if it has, is it going to slow our downward trend?
So I don't have evidence that it's been identified locally here. 99.9+% cases of ours right now are the Omicron BA1. I'm sure if it's not here, it will be here. It has been identified in the state, I'm pretty sure. Again, those people who've had the original version of the Omicron variant are pretty well protected. So we don't expect that those folks, and we do know that it's a significant number of people who had that first Omicron variant. We don't expect that there is a huge susceptible population that the second variant, the BA2, would cause a big spike in cases. If anything, what we would see is maybe that our downward trend might be delayed a little bit more, might plateau a little bit more before declining even further as that one would burn through. So, if it's not here, it will be here. We will see it. There will be other variants. And remember, there are other variants out there that just can't outcompete the highly transmissible Omicron. And, so Omicron outcompeted Delta, and that's what made Delta kind of go away. COVID has outcompeted flu and other respiratory viruses in a lot of ways. And that's why we don't see those, because that's what, outcompetes it. And the susceptible population gets infected with those. So don't expect a huge change. It might change the tail a little bit. I think it would be unlikely to see another spike from that based on what we've seen.
Okay, our next question is coming in from Allison. And again, this appears to be the last question we have in the queue. So if you have any questions, please use the Q&A or the chat. So that when you were talking about elementary schools, did the same trends, and I'm assuming she's asking about masks here, did the same trends that we see in elementary schools follow a similar pattern in universities? Are masks just as ineffective in universities?
To be honest, I have not pulled the graphs looking specifically at university populations, but I would say that yes, our university students, we know that COVID is not being spread when they go to class. We know it's being spread with their social activities and their parties and their gatherings and whatnot. So, I would say that trend probably does hold true. That most of the spread is occurring outside of the classroom. And so regardless of whether they're wearing masks in the classroom, we know they're not wearing masks at their social functions. Our university trends are down, just as our K through 12 trends and our community numbers are down. We saw, if you'll know, in the fall, we did not see much impact on our Delta curve from our university students at all. Our universities had vaccination requirements. So we didn't see much of an impact with Omicron. Omicron kind of hit when the universities were still on their winter break. We did see a little bit of a bump when the university students first came back, but then that's dropped down significantly and continues to drop just like the rest of our community, just like our K-12.
Okay, Nick has another question here. It seems that while the NRV is trending down as far as cases go, it looks like it's doing so at a slightly slower rate than the rest of the state. Is that just because Omicron peaked a little later here?
Yeah, so, Southwest Virginia, New River Valley is generally not where things are going to hit first. If you look at the state's curve, the state as a whole peaked, a week or two before we did. So that's why our downward trend is a little bit slower. So it's just, again, these things, they tend to spread regionally. So your more heavily populated areas, your more urban areas, suburban areas are definitely going to see them quicker than your more rural areas. Again, respiratory illnesses are going to spread seasonally, anything that drives people inside, because we know inside is where it's much more transmissible than outside. So we are a little bit behind, but definitely we've seen that sharp drop now as well.
That appears to be the last question we have for today. As always, we really appreciate your time and we look forward to next week.
Thank you all so much, Jen. Thank you as always. Take care.
Have a good day. Bye-bye.